Hello, this is Julia Rush, and this is my presentation on demand theory and its application as it applies to the proposal of building and opening an urgent care facility. So the basic proposal is to open an urgent care clinic. We would like to do this within 20 miles of our main hospital campus, and we're located in rural Central Coast, California. The services that we'll be providing will be available to a population of approximately 115,000 adults and children. The basic microeconomic model is that basically there will be a delivery of urgent care in our community. This would include basic laboratory services and basic radiologic services, basic um, x-rays and ultrasounds on site. It will provide referral services when somebody needs to be referred out for maybe a higher level of care or a specialty provider. The urgent care will be staffed by physicians, nurse practitioners, registered nurses, and medical assistants. In addition, there will be the coders and the billers and the housekeepers and those sorts of jobs also. But the main ones to provide the care will be the physicians, nurse practitioners, nurses, and medical assistants. And this urgent care facility will be fully equipped with exam rooms and state-of-the-art medical equipment. The role of public policy and the provision of health services in our situation is basically we're going to need to take into consideration the location and the local laws that apply to that location, whether it be city laws, state laws, and so on and so forth. We're going to need to know rules for signage because we're going to need to have a sign or more than one sign that's going to help market our facility, let people know where we are and what we are. We have to consider environmental impact, and there could even be some environmental impact studies that are required based on the local laws. We're also going to need to probably take into consideration traffic and parking considerations for our facility. Are we going to be bringing in a lot more vehicles and congestion to an area that might not have that already? And are there hurdles that we're going to need to overcome